How could modern monetary theory be applied to fund universal health care? Have you ever wondered how a government could provide universal health care without breaking the bank? Modern monetary theory, or MMT, offers a fresh perspective on this issue. MMT suggests that governments with their own currencies can create money to fund public services directly. This means they do not have to rely solely on taxes or borrowing to finance universal health care. So, how does this work in practice? First, the government can allocate funds directly to healthcare systems. This includes covering salaries for medical professionals, purchasing equipment, and ensuring that facilities are well stocked with medicines. The beauty of MMT is that this spending can happen without the immediate need to raise taxes or issue debt. Next, MMT emphasizes the importance of real resources. This means that the actual limit to spending is based on the availability of healthcare workers, hospital beds, and medical technology. If the economy is at full employment, inflation could become a concern. Therefore, it is essential to invest in training healthcare professionals and expanding infrastructure alongside increased funding. Another critical aspect of MMT is its approach to taxation. Taxes are not primarily for funding healthcare. Instead, they help manage inflation and regulate demand. If spending on universal healthcare leads to inflation, the government can adjust taxes to cool down excess demand in other sectors of the economy. Furthermore, MMT encourages a shift in focus for healthcare managers and policymakers. Instead of worrying about budget deficits, they can prioritize maximizing healthcare outcomes and value for patients. This shift could lead to improved access to care, reduced waiting times, and better overall quality of healthcare services. While MMT provides the financial means to fund universal healthcare, it does not automatically resolve systemic issues like workforce shortages or inefficiencies. Addressing these challenges requires targeted policies and investments that are informed by the increased fiscal space that MMT creates. From a socialist viewpoint, MMT is a powerful tool for realizing universal health care as a public good. It aligns with the goals of equitable access to health care and prioritizing human needs over profit. By adopting MMT, modern democracies could reshape healthcare funding to ensure comprehensive coverage. This approach could help reduce health inequalities and invest in the long-term sustainability of healthcare systems. In essence, modern monetary theory enables governments to fund universal health care by creating money directly for it, with the only constraints being real resource availability and inflation risks. This method supports the aim of expanding public healthcare access and improving social welfare through thoughtful public investment.